Diagnosis of cardiac disorders. If congenital heart disease is suspected, a chest radiograph and ECG should be performed. Although rarely diagnostic, they may be helpful in establishing that there is an abnormality of the cardiovascular system and as a baseline for assessing future changes. Echocardiography, combined with Doppler ultrasound, enables almost all causes of congenital heart disease to be diagnosed. Even when a pediatric cardiologist is not available locally, a specialist echocardiography opinion may be available via telemedicine, or else transfer to the cardiac center will be necessary. A specialist opinion is required if the child is hemodynamically unstable, if there is a heart failure, if there is cyanosis, when oxygen saturations are less than 94% due to heart disease, and when there are reduced volume pulses. ECG in children. Important features include arrhythmias, superior QRS axis, which is shown as a negative deflection in AVF, right ventricular hypertrophy, which is shown as an upright T wave in V1 over 1 month of age, left ventricular strain, which shows as inverted T wave in V6. Pitfalls. P wave morphology is rarely helpful in children. Partial right bundle branch block. Most are normal in children, although it is common in ASD. Sinus arrhythmia is a normal finding. Nomenclature of cardiac disorders. The European, as opposed to the American system, for naming congenital heart disease is referred to as sequential segmental arrangement. The advantage is that it is not necessary to remember the pattern of an eponymous syndrome, for example, tetralogy or Fowler. The disadvantage is that it is long-winded. The idea is that each component is described in turn, naming the way the atria, then the ventricles, and then the great arteries are connected. Hence, a normal heart will be described as situs solitus, i.e., the atria are in the correct orientation, concordant atrioventricular connection, and concordant ventriculo-arterial connection. Therefore, a heart of any complexity can be described in a logical step-by-step process. This system is not described here as it is beyond the scope of this book. In summary, the presentation of congenital heart disease includes antenatal ultrasound screening, where an increasing proportion is detected antenatally. Detection of a heart murmur. There is a need to differentiate innocent from pathological murmur. Cyanosis. If duct-dependent, prostaglandin to maintain ductal patency is vital for initial survival. Heart failure. Usually from left to right shunt when pulmonary vascular resistance falls. And shock. When the duct closes in severe left heart obstruction.